Imagine a world where a single statement from a public figure can instantly shake the trust parents have in their doctors, leading to tears, confusion, and potentially harmful decisions. This is the reality we're facing today, as the ripple effects of former President Donald Trump's recent comments on Tylenol and vaccines are felt in doctors' offices across the nation. But here's where it gets controversial. While medical experts unanimously advocate for evidence-based practices, Trump's words have ignited a wave of doubt, leaving parents questioning everything from prenatal care to childhood vaccinations. And this is the part most people miss: the emotional toll it takes on families and the long-term consequences for public health. The emotional fallout in exam rooms just hours after Trump's announcement linking acetaminophen, Tylenol, use during pregnancy to autism. Dr. Edith Bracho Sanchez, a pediatrician at Columbia University Irving Medical Center, witnessed the immediate impact. A mother sat in my office, tears streaming down her face, agonizing over whether her prenatal Tylenol use had caused her child's autism. In the next room, another mother, who had never before questioned vaccines, insisted on spacing out her child's shots, citing Trump's suggestion as her reason. Down the hall, a third mother reluctantly agreed to vaccinate her child, only because it was required for school in New York City. Trump's words, "Taking Tylenol is not good, don't take it, tough it out," directly contradicted the medical consensus that moderate Tylenol use during pregnancy is safe. But here's the kicker. His statement wasn't just a personal opinion. It was a public declaration that inserted itself into the intimate doctor-patient relationship, leaving physicians like me scrambling to reassure families while respecting their fears. The spread of doubt and misinformation. I'm not alone in this struggle. Colleagues nationwide are reporting similar stories. Dr. Scott Hadland, Chief of Adolescent Medicine at Mass General Brigham for Children, has fielded countless calls from parents second-guessing past decisions. In Georgia, a neonatal intensive care unit colleague, who wished to remain anonymous, shared that parents are refusing Tylenol for premature babies with heart conditions, a medication that has long been a safe and effective treatment. Trump's comments didn't stop at Tylenol. He also questioned the necessity of the hepatitis B vaccine at birth, claiming, "There's no reason to give a baby that's almost just born hepatitis B." But here's where it gets even more contentious. This statement ignores decades of data proving that the vaccine not only protects newborns from transmission during birth, but also prevents infection from household contacts who may unknowingly carry the virus. The role of controversy and counterpoints. The debate over vaccines isn't new, but Trump's remarks have reignited it with a vengeance. Last week, the CDC's Vaccine Advisory Panel, influenced by Health and Human Services Secretary Robert F. Kennedy Jr.'s appointees, debated the newborn hepatitis B dose, a recommendation in place since 1991. While they ultimately tabled a vote, the discussion itself sowed further doubt. Dr. Joanna Parga-Belinkie, a neonatologist in Pennsylvania, has seen parents increasingly decline the hepatitis B vaccine at birth. Her team launched a project to improve vaccine conversations, but now parents arrive in the delivery room with their minds made up. Any attempt to discuss the topic is perceived as pressure, leaving little room for trust building. The irony of it all, here's the sad irony. Despite the widespread doubt, the official recommendations from Trump's own Health and Human Services Department haven't changed. The FDA, in a statement released the same day as Trump's announcement, directly contradicted him, affirming that acetaminophen remains a reasonable option for pregnant women in certain scenarios. They also emphasized that high fevers during pregnancy pose risks to the baby, and acetaminophen is the only approved over-the-counter treatment. Trump's claim that Tylenol can be associated with a very increased risk of autism was also overstated. The FDA clarified that while there may be an association, a causal relationship hasn't been established, and contrary studies exist. But here's the question that lingers. Why do public figures' opinions often carry more weight than decades of scientific research? The long-term consequences. As parents grapple with these decisions, the stakes couldn't be higher. The choices they make today will shape the health of their children and communities for years to come. Physicians like me are doing our best to counsel families, but the challenge is immense. Trump's voice, amplified by media and public attention, drowns out even the clearest medical advice, at least for now. A call for reflection. This situation raises critical questions. How do we rebuild trust in science and medicine? How do we ensure that public figures' opinions don't overshadow evidence-based practices? And most importantly, how do we support parents in making informed decisions without adding to their anxiety? I'd love to hear your thoughts. Do you think public figures should exercise more caution when speaking on medical issues? Or is it the responsibility of healthcare providers to counter misinformation more effectively? Let's start a conversation, because the health of our children depends on it.